Do you expect the shutdown to last that long?
I certainly hope not. This is day 26 of the Trump Republican shutdown, and as Democrats, we've maintained from the very beginning and continue to maintain we will sit down anytime, any place with anyone, either at the Capitol or back at the White House, to reopen the government, to negotiate a bipartisan spending agreement that actually meets the needs of the American people, and to decisively address the Republican health care crisis, particularly as it relates to the urgent need to extend the Affordable Care Act tax credits so we can prevent tens of millions of Americans from experiencing dramatically increased health insurance premiums that will make access to a doctor unaffordable.
I want to come back to health care in a moment, but the Treasury Secretary accused you of playing politics personally. And I know that your Democratic whip, Catherine Clark, said on Fox this past week that shutdowns are terrible, but as she put it, it's one of the few leverage items Democrats have. Do you think Democrats are gaining from this fight?
No, our focus continues to be on driving down the high cost of living for everyday Americans. Donald Trump and Republicans promised that they would lower costs on day one. We know costs haven't gone down. They're going up. Inflation is moving in the wrong direction. The Trump tariffs have made life more expensive for the American people to the tune of thousands of additional dollars per year. We know that electricity bills are through the roof. Housing costs are too high. Child care costs are too high. Groceries too expensive. And now tens of millions of Americans are at risk of having their premiums explode, in some cases by $1,000 to $2,000 per year. That's what this fight for us is all about. Republicans have come up with a new conspiracy theory every week for the last 6 weeks. The Democratic position, Margaret, has been clear. Cancel the cuts, lower the costs, save health care.
Well, that was the quote from the whip herself when she said leverage. But I hear you on rising healthcare costs, but the immediate term, people aren't getting paid. 750,000 federal workers are on unpaid leave. 80% of the folks who work on our nuclear program are included in that figure. The Agriculture Secretary said there will be delays in food stamps for many of the 41 million people who rely on SNAP. And then at airports across the country, half of the flight delays, according to the Transportation Secretary, are because of staffing shortages. This pain is real now. So is there a point at which it becomes too great to justify continuing the shutdown?
Well, there is an urgent need to reopen the government, which is why we continue to demand that Republicans sit at the negotiating table so we can enact a spending agreement that's bipartisan in nature. That's what we've called for from the very beginning.
But the Republicans are saying they won't do that until you pass the funding bill, the clean funding bill that already passed the House. Why can't Democrats in the Senate get on board with that?
Well, we've made clear, and I'm thankful for the leadership of Chuck Schumer and Senate Democrats, that we were not going to support a partisan Republican spending bill that continues to gut the health care of the American people in an environment where Republicans have already enacted the largest cut to Medicaid in American history. Hospitals, nursing homes, and community-based health centers are closing all across the country. There's the possibility that Medicare could face a $536 billion cut, the largest cut to Medicare in history, if Congress doesn't act by the end of this year because of what Republican policies have done in their one big ugly bill. And now they refuse to extend the Affordable Care Act tax credits. That impacts working class Americans, middle class Americans, and everyday Americans throughout the country, including in rural America.